Okay, there we go. So yeah, so I did a research for my clients. Actually, they usually come with vertigo. I do cupping therapy, acupuncture, body work, and all these kind of facial work. And my background is a pediatric consultant. I have like 20 years experience teaching in University of Ottawa, and I have a lot of people that are referred from other healthcare practitioners because they didn't know what to do with them. Especially vertigo, people experience frequent falls. So they happen to twist their ankle, break their shoulder, have bruised knees, or even not able to drive because the time they just like, move their head, they're just gonna fall down. Or when they come out of the bed, they have to make sure there is a rail to hold through it or something like that. So the thing is, with the benign paroxysmal vertigo, there is only very few things that people can do. And it's very important to exclude other causes that people have to make sure they don't have a brain issue with vascularity problem. They don't have any deficiencies in their food. They don't have a brainstem problem because it can be caused from so many different issues. So if it is the diagnosis of, oh, we don't know after you go to all the doctors, or if it's benign vertigo, then this is the right thing to do. Of course, it causes a lot of frustrations for people when they have to deal with them being dizzy. I myself had this since I was 18 years old. So that's more than 30 years ago that we were preparing the the suitcase to travel. We were always traveling from countries to countries because of my dad's work, and I was preparing the bag with my mom, and all of a sudden I was sitting on the floor putting things in the bag, and then all of me just came on the bag, and she said, "Oh, what are you doing? Are you just fooling around?" I said, "No," and I just like got my head up, and since that time I had a lot of vertigo episodes that I didn't even know that they exist. When I went to the medical school, I learned about it, and I knew it was something just I needed to work with. So what we are going to do here is not ignoring what the Western medicine say, it's just completing it. We're going to complete the picture and see how things are with people and why they are frustrated. And I'm going to give you some tools to go home and do it by yourself if you are experiencing vertigo or you know somebody who is. And at last, we are going to open the time for questions and answers. So everybody that attends these sessions are either doctors, health practitioners, or people who experience some sort of vertigo, or even know people who experienced vertigo before. And like we're just opening your eyes to know and have a control over your health issues, okay? So who knows what that is? Anybody?
Is this the ear, the inner ear?
Okay, this is like, the inner ear is going to be some sort over here where the blue circle is. Okay, can you see any teeth in the picture?
Yeah, here on the right side.
On the side, yeah. So this is the mouth. So this is somebody who split in a half. We call it sagittal section. And this is the tongue. Okay. This one here is where the epiglottis is, like the one that closes your throat when you swallow. This is the Adam's apple. This is the hyoid bone. So all of this is actually a place under your tongue and deep in your neck. Okay. And the reason I got this picture is because there is something very, very important that we need to know, that our cervical spine, or the spine that we have in our neck, they transfer blood to our brain. And not only that, the first, second, and third nerves come and hook and go between muscles and stuff like that. So I have to stop the share for a minute just to show you stuff. So if you can see me in a video right now, like I'm talking about this area, it's called strap muscles or neck muscles. So all the way from under the tongue and all the way until the ears. So in McMaster University, they say that the temporomandibular joint has something called it's actually connected to your cervical spine. They didn't give a lot of details over there, but you can see the ansa cervicalis, or the nerve that we saw, like cervical 1, 2, and 3. They come from the spine in the back of the neck. I have a slide for that I'm going to show you in a bit. But people who have a problem also with their posture, that you can look at them standing in front of the mirror and you see one shoulder a little bit like, lower than the other, a little bit curved to the front. Is very important to see yourself in a mirror when you're grounding yourself, like standing up on the ground, shoulders up, back straight, chin tucked in a little bit, and look at your shoulder. This is the first thing you have to visualize in the mirror, because in our inner ear there is something called circular canals. They look like the seashell, and they have something called lymph inside them, and this lymph has to be balanced between both sides. So it's like a liquid that control a third of our balance. It's in our inner ears. So imagine if I'm tilted, like one shoulder a little bit lower than the other one, my head has to still be straight. So I'm going to tilt my head to make it straight. So this liquid inside is going to be unbalanced. So when I'm standing up all of a sudden, or if I'm turning in the bed, or if I'm getting something from the ground, I can easily get knocked. And I have somebody who had concussion 3 times in 1 month because of this issue. So what happens is you have to correct this first. Like when you have some muscles contracted in one side and the other one is relaxed, and this is not balanced. So this is the first thing you have to work on. The other thing, imagine these muscles, like I'm going to show you a picture in a bit. These muscles have muscle fibers, and the nerves kind of pass in between these muscle fibers. When this muscle is tight, actually it presses it down. Okay, so I want you to do, yes, go ahead, Anthony. What do you want to say?
I was just wondering, I've broken my right collarbone about 3 or 4 times in my life, and I have to wear a brace to keep it, tight, because it pops out a lot and stuff. Could that be an issue with vertigo? Because if my right collarbone side isn't compressed in the way it's supposed to be, could that affect from left to right? I mean, like,
this is really important question. I will answer this through something. I'm just going to open the Safari. I will show you some very interesting picture over here. So I'm going to do a subclavian artery. Okay. So can you see the picture right now? Images?
yes.
Okay. So I'm going to get one image and zoom on it when it's related to your, yes, here. Can you see this picture on the right? Here, this one.
Oh wait, the other one.
This what?
Okay.
This is big enough?
Yeah.
Let me do here. Yeah. So this is your collarbone over here. And underneath this is a very big artery that comes from your heart. Okay. It's called brachiocephalic trunk on the right side. Did you break your right or left side, Anthony?
My right side.
Your right side.
Well,
So
yeah, my right side.
okay, so we're speaking about the right area over here. So this is the right side, and this is it's called brachiocephalic trunk. Brachio means arm, and cephalic means brain. So this collarbone just lies under this trunk over here, you can see. So if you break this bone, there is something called fascia. We spoke about it in a previous 2 videos. This fascia is the thing that actually help things glide on top of each other. So this collarbone might have caused some adhesions underneath, or some sticky fibers that will block a little bit of the circulation over here. So we need to do a little bit of neck things. We're going to do some neck exercises right now. You're going to see if your muscles on this side is affected or not, because if that, you can see that this artery over here, or this blood that's coming from the heart way up to your brain, actually passes through the collarbone and then passes underneath your neck muscles, and then it enters your brain from the front. Can you see?
Okay.
And you can see it passes under muscles in your neck as well. So we're going to do a little bit of assessment together, but I want everyone to be very stable. Like, I don't want anybody to have any chance to falling down. So if you sit in a place that if you feel dizzy or something, you're already supported, that will help us understand how our neck muscles work. Okay, so the first muscle that we are going to do is this one over here, which is, can you see this muscle? It's called sternocleidomastoid. And you can see it's attached to your collarbone, again, attached to your sternum, which is the chest bone. And over the sternum, there is a muscle over here. It's called the sternalis. So it's also attached to it. And it's attached behind your ears. Okay, we have this muscle on both sides. So we're gonna test this muscle right now. Okay, so in order for this muscle to come relaxed, you need to get your head tilted a little bit to the front and try to hold behind your ears, okay, over here. And we're gonna do one side at a time. So behind my ear, I'm gonna feel a big chunk of a muscle and press over it all the way until it comes to your sternum. Okay. And check if you have anything that is hurting you. On the middle. Can you feel it? And then we're gonna do the other side from the back of our ears. Just press, medium press with 2 fingers over here. And then again, all the way until you reach to your sternum over here. Okay, anybody experience any pain? Any tightness, any pain, any knots? This muscle has been linked a lot to vertigo because of how it is related to these nerves. I'm going to get you the ansa cervicalis again right now, and I'll explain more. So over here, can you see it right now?
Blank screen. Oh yeah, yeah.
Okay, good. So this is cervical 1, 2, and 3. So that means this is the nerve that comes from our first cervical vertebrae or spine. This is the second, and this is the third. And they pass in between the muscles. It's actually hooks around your internal carotid artery and the jugular vein, and in the carotid sheath, and on the medial side of your sternocleidomastoid. So you know that the carotid sheath and the common carotid artery have a lot of like like the what you call it, vagal receptors. So if this nerve is compressed, actually it's going to cause you to be dizzy because the whole structure here is going to be so tight. Okay, so this is one of the things. The other thing is this back of the neck over here. You see there is a lot of nerves as well. Not only these nerves, but also the blood that circulate to the brain up there. The fascia is allowing the nerves to come between our cervical spine, pierces the layers of your scalp, and then get out underneath your hair. Like imagine like these tightness over here. What are they going to do up here? You know what I mean? Like it's a very complex anatomy over here that we need to do assessment and see if we need to get any help done. So we're going to do this after we I'm just going to stop share here, and we're going to do assessment for our neck mobility as well. Okay, so in the beginning, try to tuck your chin a little bit in like that, and then take your head and lean it a little bit to the side without tilting up here. Be careful when you're doing that. If you have any tightness, if you have any dizziness, just stop doing that. So do this and take your head all the way until your shoulder. Have a deep breathing in. When you have deep breathing in, you're going to be able to switch it a little bit more. And then your other arm, tuck it behind your back like this. And see if there is any stretch over here. So we're going to do 1, 2, 3, 4, and 5. And then we're going to let go. And then we're going to experience this with the other side as well. So put your hand on top of your head and lean a little bit toward the same side of shoulder, all the way here. And then get your other hand and get it to the back. Just keep doing that with deep breathing. Now we are going, anybody experience any problem